Right.
Do you want a mallet?
Quiet, please, in the room. Good afternoon again. And 2:45, it's the Cabinet Member for Health and Adult Social Care, Dr. Mahoney, Anna Coles, Ruth Harrell, is she online? Rachel Silcock and Gary Wallace.
No, it's not Gary Wallace, Gary Wallbridge. Wallbridge, it should be, not Wallace.
So Gary Wallbridge instead of Mr. Wallace, it's on the sheet. Looking at health, wellbeing hubs investment programme, older people's services, market sufficiency, fair cost of care, impact of ASC, reform, mental health and physical disability services. If I hand it over, please, to Dr. Mahoney to kick off, please.
Thank you, Chair, and afternoon, everyone. Adult social care budgets are demanding countrywide for a largely need-led and strategic service, statutory service. But despite this, adult social care in Plymouth continues to support over 4,700 vulnerable adults, 2,000 carers, and employs over 5,600 workers. And I'd like to take this opportunity to thank everyone, each and every one of those workers, in caring for Plymouth's most vulnerable people. But as we know, both nationally and locally, adult social care is under unprecedented pressure. The long-standing issues of growing complexity of need has been compounded by dealing with COVID, and significant challenges within the NHS are placing further pressures on the sector, along with rising costs of energy and fuel. Also, the sector is now facing a significant workforce shortage. Indeed, workforce remains our single biggest challenge. We estimate that vacancy levels are running at about 10%. This is despite our successful Make a Difference recruitment, which we will continue to promote, as well as working closely with colleges, universities and health providers to create career pathways and apprenticeships. Financially, the Directorate still focuses on working to deliver a balanced budget. As month 10 shows, we're again forecast to break even and have also delivered nearly £3 million of savings in year. People at the Heart of Care has started the process of adult social care reform and brings additional funding into the sector. In total, this amounts nationally to £5.4 billion over 3 years. This year we received an additional £900,000, which we were able to passport to the care market, uplifting contracts within domiciliary care, care homes and supported living. Next year we will receive £1.2 million towards developing and delivering a sustainable care market. Next year's budget will of course be a challenge and we will need to deliver savings, but we have built in growth for the market and demography. In terms of efficiencies, we're looking to deliver around 3.7 million in savings, similar to this year. In terms of growth, we have a provision of around £7.5 million. Overall, this settlement will allow us to continue to support the city's most vulnerable adults, and it will also allow us to pay for provider uplifts. We're proposing 8% for residential and nursing, day opportunity and supported living and extra care facilities, and 11% for home care, and thus start the important recovery and reform of the sector. This year we have achieved a lot working with the NHS and voluntary and community sector organisations to maximise the return on financial resources. Also, we have used innovatively government monies which have come in a couple of tranches in order to help staff retention, staff recruitment, and to sponsor certain discharge initiatives to reduce discharge backlogs at Derriford Hospital. We have the Venton Centre, which is a short-term treatment centre. We have Jury's Inn, which is the care hotel. And more recently, winter pressures monies have arrived, which very quickly the team have used to invest in independence at home, which will ease discharge for reablement patients by increasing the hours available. We have arranged increased support for one-to-one staffing levels for patients with complex needs, using a multidisciplinary team to support them when they are discharged into care homes, which is more appropriate than remaining in hospital. Some money is also being used for further international recruitment support to support social care providers and to enable a more sustainable workforce. Finally, extra short-term support in cooperation with Age UK has been arranged in the last month to assist patients being discharged from Mount Gold Hospital, the Venton Centre or the Care Hotel by offering more short-term support for the patients and their families in their homes. Thank you.
Thank you, Dr. Mahoney. Questions from the floor, please? Is there any?
Councillor Lang, Councillor Partridge.
Councillor Lang, Councillor.
Okay. Thank you, Chair. Put the cooker down. Right. Dr. Mahoney, the government over the years has said that we had to put a 2% precept on our council tax, with anticipation of there being a look at how government was going to restructure the funding for social care. Now, this has gone on and on and on, much longer than all of us thought it would go on. So is it fair to load this onto the local community when they're paying their council tax, etc.? And how are we going to be pushing, or how are you as cabinet member going to be pushing to ask government to get this sorted?
That's quite a political question, and of course one that's affecting the whole country. I mean, ultimately it is not sustainable that we can go on loading more and more onto the council tax when there needs to be a nationwide system for funding elderly care which is equitable for everyone. And as you say, the proposal has been delayed by a couple of years. I have a feeling that that is going to give the local authorities a little more time to sort out how they're going to manage, how people pay or don't pay, and the new structures for paying or not paying under the Care Act. But I think it's a nationwide thing. We all read in the journals and in the press about how this needs to be a solution. It's been a decade or more that we've been awaiting a national system that would actually take pressure off local councils to fund adult social care. But we are where we are, and there is a further delay, as you know.
And what have we raised this current year in council from the precept in council tax, please?
Well, it's 2%, and how much does each percent raise it? $1 million, I'm not sure.
That's a good estimate, yes. It's about 2.4 million, something like that, in the current year. Just over 1.1 million per 1%.
And obviously that's on everybody paying. And I know that, David, I think we've had that conversation before, that you put it up front and passport it over, but that relies on everybody paying their council tax and the precept. So have you got a hiccup with that, or has that been okay?
So we've set the council tax levy again for next year at 97.5% collection rate. Why 97.5 and not 98, 96? It held up at that level during the pandemic. Talking across the country to other colleagues, that's the kind of rate that they're using. So I'm confident that 97.5 will be okay. So in terms of budget impact, that's built in already, that it's a 97.5. If we do achieve more, then that will roll out in future years' funding, but 97.5 seems sensible.
Councillor Partridge, please.
Thank you, Chair. A question for the Cabinet member and his team. With regards to the Care Hotel, how many floors do we use, or do the hospital use, and who is covering that bill? And out of that bill, does the Integrated Care Board contribute all or some towards paying for that?
Well, I will give you the answer that I think is correct. I think we're on 2 floors and it's a maximum of 40 beds. I mean, last year, if you remember, we used the Future Inn under a similar arrangement. It's now Juries, although it's now called something else. And I think I'm right in saying that the money is coming from the Integrated Care Board, and we are sharing some of the beds with Cornwall. Up to 10, I think, or depending on how many we've got and how many they think they need, because actually there is a much bigger problem discharging patients home to Cornwall than we have in Plymouth. There's a much bigger delay, which is causing a backlog at Derriford Hospital. So, we are maximising the use and involving Cornwall in order to help the pressures on Plymouth Hospitals Trust.
Chair, if you don't mind, I'll have a quick supplementary on that one, please.
Yes, by all means.
So, just from my understanding then, the 2% precept that we raise as a city, Plymouth City Council and its taxpayers aren't paying a penny towards the upkeep of that care hospital.
Sure, they are not. No, the answer is no.
Thank you so much.
Councillor Coker, please.
Thank you, Chair. Councillor Mahoney, we've talked about the areas of deprivation this morning on various issues. How is your budget, and I know Ruth's pricked her ears up, how is your budget going to help improve the areas of deprivation, bearing in mind that the current indices for my ward and some of the others have got worse? So what's in the budget for next year that will make a difference to those areas? Because I can't see anything.
Thank you, Councillor Coker. Well, it's long been a concern in Plymouth about the difference in life expectancy and morbidity between particularly the east of the city and the west of the city. Now, it's nothing new, and I probably think that COVID has probably set us back on that, improving the health and life expectancies. Ruth may say more later. Ruth, well, there are some interventions which are detailed and will help the deprived areas. Some of the money going into the health hubs is destined to actually improve people's lifestyles and improve the way that they take care of themselves and signpost them to various organisations, be it to have their blood pressure checked or because they've got other issues that they need sorting. I think in the longer term, we are hoping that as we get more of the fair shares money, and we have got some of the fair shares money, and I think Ruth may want to talk about this later, the money that we think we need from One Devon ICS that for many years we haven't been getting because perhaps it's been going to East Devon and places like that. We are getting some of that money, and that will be targeted and has been targeted to certain projects that will happen in the city, particularly looking at the more deprived areas where the indices for life expectancy aren't so good. One example of that would be that smoking cessation is being targeted via some GP practices in those areas. And it's small things like this that actually can ultimately improve the lifestyle and improve the life expectancy. But of course, it doesn't happen overnight. We're looking at a long-term trend. Various healthy exercise programs as well, and some intervention in the workforce. Employers are being offered ways of, ensuring that some of their employees have things like their blood pressures checked, which again, blood pressure is a big killer if you don't know you've got it and it's not being treated. So would you like to say some more about that, Ruth?
Yes, thank you very much. So as you've given some great examples there, in particular of the way in which our public health budget and also some of the health services budget does tend to be geared towards trying to support more deprived areas. Probably worth also mentioning that we've had an additional funding next year and this year, but a large amount next year, £800,000 approximately, to go towards drug treatment, and that's particularly targeted around harm reduction in communities. So that's got an impact on crime that other people might experience, as well, of course, of supporting people who've got substance misuse issues, and of course their families as well. So that's additional money that will be supporting some of our population. A couple of other things I wanted to mention. One is it's slightly more on the health side, so not directly funded by us, but certainly University of Plymouth. Sorry, that's the next thing I wanted to mention. Sorry, the hospital I was going to say have been doing a lot of research into looking at how the things like their outpatient appointments, their A&E admissions, and their attendances, etc., is geared to deprivation, and have some really good plans for trying to understand how some of the barriers to accessing healthcare can be identified in some of those populations, to try to shift, because we're always trying to shift to the prevention angle, aren't we? So if somebody's being diagnosed at because they've come into A&E, actually what we'd like is for them to have been diagnosed a little bit earlier in perhaps a GP setting or an outpatient setting, rather than urgent and emergency. So there's lots of exciting work around that. And in terms of budgets, there's two other things probably to mention. One is University of Plymouth work. We've been lucky enough to be awarded a National Institute of Health Research award for tackling those wider determinants of health. So this is the fact that you cannot prevent the impacts of deprivation simply by looking at the health angle. That's just not going to work. You've got to look at the wider determinants, where people live, the schools they go to, the jobs they end up with, the places that they need to go and do their shopping, all those impacts to do with their budgets, etc. And we've been lucky enough to be awarded the funding to develop a health determinants research collaboration within Plymouth, with us and the university being the key key partners in that. And that's a piece of work that will be going on for about 5 years, and is going to be really interesting, and hopefully we'll start to get to the heart of some of the issues that Councillor Coker is talking about. And in fact, one of the projects that we've already started off is looking specifically at some of the work in Councillor Coker's ward, to understand the impact of some of the redevelopment that's gone on, and why that isn't shifting the health indices in the way in which we'd like to see. Just if I may, I think Councillor Dr. Mahoney gave me the sort of the opportunity to mention life expectancy, and although our life expectancy is below England, which is not where we want it to be, it is worth noting that it is the highest for both men and women when you look at other areas that are statistically similar to us, that have similar levels of deprivation and similar populations. So although there's a lot more that we want to do, and we want to tackle that deprivation and the impacts of that, we're not in a bad position at the moment relative to our statistical neighbours. But as I say, definitely something that we want to do further and better on. Thank you.
Supplementary, Councillor Coker.
Yeah, thank you, Chair. Just to follow up from that, Ruth, I appreciate that detailed report. One of the things that I'm led to believe, and I'm looking at our health colleagues, is that access to open spaces, to sports facilities, to exercise facilities is really important. Would you both join with me in actually doing the utmost to make sure that Mount Wise are still free and accessible to one of the most vulnerable communities in the city?
I mean, you're referring to the fact there's a proposal to look at the charging costs of the public pools and whatever. I think it was felt that if and when Mount Wise was charged for, maybe there should be some reduction, or even possibly not charging for local residents. I mean, it's not only local residents who go there by all accounts. Well, I know people who go from other parts of the city and go swimming there because they like swimming in the pools there. I mean, so I think that's yet to be determined, but I think it would be good if it could be encouraged that local residents paid less, and particularly younger people who we want to encourage to, start swimming and keeping fit. But of course, on the positive side, hopefully, if the Brickfields proposal goes through, we might end up with some more sports and leisure facilities there, which, again, are in the heart of the Devonport community and not far from Stonehouse. So, one can only be hopeful that there might be more leisure and sporting facilities there of varying types.
Councillor Kelly, please.
Thank you, Chair. We've heard about prevention, and we've heard about the sort of crisis that the health service generally is in with the shortage of GPs, especially in Plymouth, and then ambulance and discharging. And Councillor Mahoney, as a doctor, you're probably better placed than all of us to understand. What's the impact from your point of view with regards to the fact that the Cavell Centre, or the Colin Campbell Court Super Health Hub, which was not only going to regenerate the city centre, but be a major provision of health services in a deprived area that would allow people perhaps to have greater access to medical care, arguably save more money by quicker interventions, now being certainly put on the back burner for the foreseeable future? And what interim measures are you looking to take as the cabinet portfolio to plug that loss of provision, basically, when we've already got a city that is very poorly provided for, especially with GPs, and hence the exacerbation of people going to A&E and all the ongoing issues that that causes?
Thank you, Councillor Kelly. A very complicated issue, one rather dear to my heart. I mean, quite what is happening in GP land, I'm not quite sure. Yes, there is a shortage of GPs, or at least there's a shortage of GPs who are working full time. Having said that, they all now have, most practices seem to have paramedics, nurse practitioners, advanced medical practitioners, and all sorts of people, pharmacists that ought to be actually spreading the load, you know, dealing with the queries and problems and issues that don't have to be dealt with by GPs, because GPs aren't the best people to deal with everything. Coming back to the Cavell Centre, I think the great strength of the Cavell Centre was not necessarily the GP practices that are going to move in, because the GP practices are working anyway. I think the challenge there was for them all to work together and have a sort of single front of house opening, so that if you have a problem, you could get seen on the day by whoever, not, you know, 4 separate practices working separately. So I think that needs looking at. But the great strength that it was going to have diagnostics, investigation, treatment facilities, and of course the much needed dental suite, which of course is subject of conversations elsewhere, although the university wants to open, as we all know from the last council meeting, a dental facility if NHS England will permit them to do so. So I don't think all is lost. I mean, things seem to be developing in the last few days, and you may or may not be aware that Plymouth Hospitals wants to open some sort of centre in the centre of Plymouth in order to have investigations conducted, you know, not at Derriford, which again is good news for the people who live around the city centre, who may or may not have the transport that other people in other parts of the city have. So I think that is going to happen, whether there is some opening, and I think there's the possibility that the Cavell Centre and that could be worked together. So, you know, there's unknowns at the moment. I think we should certainly not be giving up on the idea that we want the Cavell Centre in its full form, and if Plymouth Hospitals then build another centre for investigations, that would be great. But we certainly need more facilities in the west end of the city to make it more accessible for patients, because, you know, people do find it difficult to get to Derriford, and actually a lot of these things do not need to be done in Derriford, which is part of the problem with congestion and too many people up there, and A&E gets flooded out. If we can actually nip things in the bud and deal with them more locally, then that can only be for the better. So I am not, I've certainly not given up on the Cavell Centre. I mean, Anna might like to say a few words on this. So I think we've got to work and push it forward, but there was some slightly better news in the Herald, I think last night or the night before.
Yeah, as you've alluded to, Councillor Mahoney, you know, you were a practicing GP, and certainly, you know, the residents that speak to me of all ages, their number one concern is that they've just basically given up trying to get a doctor's appointment in any meaningful time. As somebody that knows the inside track, and now as the cabinet member for health, what have you sort of personally done to try to improve the situation in Plymouth, because it is such an acute issue? And sadly, be it COVID or not, we all read that I guess there's an awful lot of people that will not be diagnosed with quite serious things, and that in itself will have a lag that will put more pressure, because if it had been caught earlier, they might have had better preventative and a better outcome. And you just cannot get doctor's appointments really for love nor money at the moment, certainly in my experience anyway.
It is a huge problem, and I'm a bit at a loss to discover why, because we suddenly haven't lost that many GPs, certainly not since before COVID. Everything seems to be working differently post-COVID. There's certainly a place for triage, e-consult, video consultations, but there is also the need for face-to-face consultations, because that is when some of the problems get fully elicited. And I have a feeling that sometimes matters aren't being dealt with properly, and it's a revolving door situation, which actually means that patients are having more consultations, which means there's less consultations for people who want them. I've been to visit various practices because I know people in them. I see the way they're working. I mean, I've been to practices in Plymouth, the Mayflower Group, talked to people from other practices.
Dr. Mahoney, can I just interject here, please? I think we're going a bit down the wrong path here. We need to stick to the budget and the budget implications to the local authority. And I think questions such as what Councillor Kelly's just said and what you've been answering are best left to the Health Scrutiny panel to discuss in due course. So if we can keep all the questioning, please.
Thank you, Chair.
Committee
I am hoping to meet, or planning to meet, with Sarah Wollaston ASAP to discuss some of these issues. So not forgotten.
Yes, I'd just like to ask a question with regard to page 176 of the bundle. As we note, the previous risk rating, the current risk rating were severely in the red. I'd like to know what the ramifications are to the budget, and both for the end of this financial year and the next financial year. And there's a second part to the question I'd like to ask. Are we making good use of the continuing healthcare assessment, i.e. the funding provided by the NHS, with regard to any funding packages that we're putting together? Thank you.
Well, I will start to answer that question, and then I'm sure my colleagues will enlarge upon it. Staffing and recruitment is the biggest problem. I mean, there have been recruitment fairs in the last 6 months. There was a very large one in the future in October involving the NHS in its various guises and social care providers, which I think has resulted in some recruitment. We have international recruitment going on, which is being funded by some government money. I alluded to that. I mean, we've had several chunks of money going into recruiting internationally, which of course Derriford Hospital has been doing on its own for many years. There's a Medifest this Friday, which is involving a soon to be school leavers, to sort of interest them in whether they might like to go into the health and caring professions. So there are various measures being taken to try and support the workforce. But of course, as we know, for some people, we're competing with the leisure industry for the same sort of people who are doing the work in care homes and in the domiciliary care service. So it's a difficult market. But I think Anna probably would like to say more about this.
Thanks, Councillor Mahoney. So I think, as Councillor Mahoney's described, the workforce clearly an absolute challenge. But I think we do need to set this in the context of where Plymouth sits from a national perspective as well. So we've done a huge amount of analysis around turnover rates and those types of things, because we've done so much work in this area, because it is about recruitment, but it's also really importantly about retention as well. So just looking at the latest stats against a sort of southwest average, we're averaging a turnover rate of 36.5 in Plymouth. Across the rest of the southwest, it's 40.6. So I know that actually turnover at over 30 is absolutely not where we'd want to be, but I think it does just start to describe we are starting to see some progress in terms of not only the recruitment, but absolutely critically the retention as well. Having engaged with our providers, we're bringing people into the market, but actually we're losing those people as well. And of course, the impact of that is the training that goes on, and then actually losing that workforce is a real problem. So I think we are just starting to see some green shoots. Absolutely not where we would want to be, but we are starting to see some of those shoots come through. And I think we should acknowledge good work in a system that's under an awful lot of pressure at the moment.
So just a supplementary to that. So even though we're in the red, you're confident financially that we can meet all our obligations within current budget constraints?
I mean, I suspect if we can recruit the people, we can pay them. I mean, we're within budget this year. So I see no reason why we shouldn't be able to do that next year. It is a question of finding the people to do the work, not just in hospital setting, but in domiciliary care setting, in the care home setting. It's multifactorial. But I wouldn't have thought the budget was the biggest threat. I think it's actually maintaining the service and providing the service to the people who need it that's the biggest risk.
Thank you very much. Councillor Lowry, please.
I've been very impressed, Councillor Mahoney, by your introduction and your response to the questions that have been asked so far today. You have been very candid and transparent about the issues that exist within the Directorate. And like many, I've sat here for a number of years, and we know full well this has always been an area of concern. But it's probably fair to say that we've moved on now to perhaps a more uncomfortable place than we've ever been. I sadly read international newspapers, and there's an article yesterday in the CNN, American newspapers, about the much-loved NHS falling apart. I mean, we often hear those words used on the TV or social media, and I'm just concerned that given your candidness and your honesty as to the problems that exist, do we have a robust plan for the next 12 months to deal with the storm that continues to be happening around us? And I know you guys can't give me a yes or no, nor do I want that. I would just like to see, actually, we have got a plan and this is it, actually. And not to articulate now, but obviously you to a certain degree do so. But I would like us to think about, have we got a plan for dealing with this falling apart or this challenging times that we currently live in from a health perspective? Because we hear it every day. So I'll shut up now and let you respond.
It's very interesting, and we could discuss that for hours probably. I mean, I think it's becoming cross-party aware now that there needs to be some reform in the NHS and there needs to be some changes, and they may take a variety of forms. But I think we in this room are not here to actually sort out the problems of the NHS. I think what we've got to focus on doing when the NHS is under such pressure for whatever reasons, from primary care right through to secondary care, is actually make sure that we're providing the care for the elderly and the vulnerable people who we don't want to be in hospital for longer than they need to be. We want to avoid them going into hospital if we can. We've got things like the frailty service that goes into residential homes and tries to, keep people out of hospital, because for anybody, hospital's not a pleasant experience. It's not one you want to have unless you've got to. And the older you are, I think the more inappropriate it can be. So we've got to keep people out. And then when they're in hospital and they finish their treatment, get them out as soon as we can. And as I say, I think despite the difficult challenges of workforce in all the arms of the care service, once they come out of hospital, we are managing to keep our head above water on that. And that is what we've got to focus on doing. I don't think we can be there necessarily to sort out the wider issues of the NHS, but I'm very happy to have a chat about it sometime.
I'd love to have a chat, John, but I don't want to do it now or take up any time. It either becomes some form of a recommendation for us to take forward, and I know this week there's a health scrutiny anyhow, where perhaps they can explore in the health scrutiny this week, the budget in the context of those issues that Councillor Mahoney's raised.
I think that's totally reasonable, Councillor Lowry, and yes, something that, because obviously we're talking about hospitals here, we're talking about GP surgeries, we're talking about the implications to the private sector with regard to rooms, social care. So I think I'm more than happy to recommend, if the health chair is happy to take that on, to consider that at the next health scrutiny. Sorry, David.
That's okay, Chair. If I just come in. Part of my role here is to make sure that we're setting a robust budget, and we're not just putting numbers on a piece of paper. I could have sat in the darkened room and done that. So working with the directorates and with this team in particular to make sure that the numbers that are going forward do stack up. And I just think I'll pick up on what Councillor Lowry has already said, that if you look back of the recent history, they have come in within budget. In fact, been able to be in a position to support the Children's Directorate with the problems that we talked about in the previous session. Now, we're not in that position of luxury anymore because the world has moved on, post-pandemic, etc., etc. But I'd just like to give some reassurance that I've gone through all the numbers and talking, I say this all the time, colleagues around the country, I think it's not to say we're in a fortunate position because we've worked hard to be in the position, but the relationship that we've got with the health colleagues is second to none. And, people are envious when I say, no, we pick the phone up and we have a conversation. So I just want to keep reiterating that we are in a very strong position. And I think in terms of the question of, we're not here to solve the problem of the NHS. What we've got to do is live within the constraints of the budget that we've got in front of us and make sure that we do protect the vulnerable. And I would just like to say I'm confident that we're in that position going forward.
Yeah, thank you for that honest appraisal, David. Thank you.
I just come in on that. I mean, I went to an LGA training session on adult social care back in October, and certainly we are held in high esteem because of various projects that we have initiated across the city over the last few years. So, we do have a reputation. So, thanks to the team we've had before, which has evolved into the team we have now.
Councillor Hayden, please.
Thank you, and through you, Chair, to the Cabinet Member. Obviously, adult social care, our care packages is, a great pressure on us. How many did we see last year to how many we see this year, and the difference in the figures, please?
Just give me a moment to find my
I do beg my ignorance, but we have different care packages as well, don't we? We have our standard care package and then our more enhanced. I've probably said the wrong word, but you know what I mean.
Well, between the 1st of April 22 and the 31st of December 22, 1,202 people have received long-term social care support in a care home setting. It's actually slightly down on the same period, 1% in the previous year. Again, in the same period, 2,912 people have received long-term social care support in a community-based setting. That's domiciliary care or supported living. That's 3.8% down on the same period in 2021. Between the same period, 689 people have received long-term social care support via direct payment, and that's 13.1% up on the previous period. So, more people are choosing to actually pay for the care, tailor the care to what they need themselves. So does that assist you in any way?
Yeah, that does. And what pressure does that have for us on your budget, please?
Well, we lived within it this year in the budget. I mean, the budget is more or less turning out as it should. So despite the slight ups and downs, I think Gary would like to go in here anyway.
Hi, Councillor Hayden. I think it's probably worth to say, while some of those you've seen a slight and modest reduction, for example, the direct payments, you've seen an increase. So in effect, those things have been kind of netting themselves out as best we could manage it. And I think that change of profile, one last year was an unusual year from a social care perspective. So I think, we have to also just bear that in mind. And some of that profile change is, of course, around the workforce challenges that we have around in the city, where you see a bit more of a shift of direct payments that help people find alternative means to support themselves rather than some of those traditional approaches as well.
That's fine. Thank you, Chair. Thank you.
Councillor Aspinall.
Thank you very much. Fair cost of care. We're obviously going through a reform there at the moment. If you take that alongside market forces that are going, things that are happening there, what implications are they for the budget, and what extra stresses will they put on your budget, Dr. Mahoney? Because obviously we know there's a workforce problem. We know that we need to get packages of care to people. We know there are people waiting. There are some of them in the care hotels, and we're not paying for the care hotels, so that's quite convenient for us. But to be able to get them out of there within that 6 weeks of enablement or whatever they're having, we need to be putting something into place. So how all of those things, it's sort of that whole sphere, isn't it, of how do we manage that and what effect is that having on your budget?
Well, fair cost of care is probably long awaited, and obviously I think wages have to rise in the care sector because A, they deserve it, and B, in order to recruit people, we're going to have to pay more. As you'll see in the budget, we have taken account of the rise in the national living wage, which is coming into effect. Obviously, if wage rises were to go further and have to be risen further in the next year, that would put pressure on the budget. But can I pass over either to David here or Gary or Anna to say how they think that might pan out? I mean, one can't entirely predict what inflation is going to be in a year's time, just like we wouldn't have predicted probably a year, 15 months ago we are where we are now. Hopefully it's going to go down, and this is going to reduce the pressure on all sorts of things, including utilities and fuel. Well, fuel is already dropping, I mean, quite dramatically at the pumps. So does anyone else have anything further to say?
So clearly we've embarked on the fair cost of care exercise. We've engaged with the market in that respect. We've had some analysis like other local authorities, and I think the response rate has been very limited in the city. So we won't be using the fair cost of care analysis to set fee rates. But we are absolutely committed to looking at getting the enhancement out to care staff, and you'll see through the growth that's built into the budget that actually, as Councillor Mahoney described at the start of this, we're looking to uplift fee rates both across bedded care and importantly across community care, because I think, as we've described, the workforce challenges in community services and particularly domiciliary care and supported living is probably the area where we have greater workforce challenges. So we will be looking to uplift those rates to a greater extent than across our care homes. So we're modelling at the moment on 8% in terms of care homes and 11% in terms of that home care. Through the engagement that we've had with providers, they have signalled that that would be extremely favourable in terms of the recruitment. Clearly we'll need to monitor that throughout the year, as we do every year, and I think as David has described, you know, we do have a track record in adult social care, both in working in partnership with the NHS to make really good use of short-term investment to address some of the hospital challenges, to ensure that we protect the adult social care budget to meet our statutory responsibilities as a local authority, and we'll continue to do that this year, Mary.
Thank you. I mean, Gary, I appreciate your staff and your team have to cope with various crises that come along, and so I suppose it's really making sure that you've got that flexibility to be able to make sure that if, and Anna as well, that if a care home hits a problem area, whether it's not receiving a CQC adequate result, you know, report and whatever, that you are able to help set in, and you've got the Quake team to help and stuff like that. So where within the budget are we looking for those extras to make sure that if the worst happens, we can still be as reactive as we've been so far to protect our people in care homes, etc.
So I'll pick that one up first, Mary, and I'm sure that Gary will want to come in. So we have 97 care homes in the city. We've got around 2,500 beds in terms of our care home market. That's a mixture of older persons and learning disability. You're right, Councillor Aspinall, to raise with us the market sustainability. So we have this year had 4 nursing and residential homes close in the city. That has reduced the number of beds. But what we do know is that actually from a capacity perspective, we still have enough beds in the city to support those individuals with the most vulnerable needs. So our Quake team will continue to work with those providers as they do. I think it's important to acknowledge the role of Live Well South West as the provider of adult social care in this city. And actually right the way through COVID, and we have continued to work with the care home liaison service and the locality social care teams, so that if we do have a care home that we're particularly concerned about, we can step in, we can provide that clinical support, we can provide that oversight support, and if necessary, assist with agency costs. So we have built that flexibility in through our budget, and we'll continue to support in that way. The key is absolutely stabilising the care market and making sure that we're making the right use of the capacity that we have in the right places, and we'll continue to do that in partnership with NHS colleagues.
Councillor Kelly.
Thank you. Councillor Mahoney, you alluded to some projects that have been delivered or held in great esteem throughout the country. I presume the Alliance contract would fall into that category. I know it was quite a bold move when it was done. My question is, has that realised not only the outcomes but the potential cost savings? Hence, we're in a budget meeting. And forgive my ignorance, but would that sort of model lend itself to be replicated elsewhere within your portfolio? I appreciate there's a lot of work and a lot of liaison, but could something similar covering other areas benefit with regards to the budget that might possibly lead to a recommendation for that to be considered if it hasn't already?
Well, I mean, I think we're spending, is it 3.6 million on it this year, and it's covering all sorts of things which involve health, like substance misuse and whatever. Part of it, of course, falls into communities because of the housing issue and domestic abuse and all sorts of things. I don't think I'm quite in a position to say whether we're getting value for money, but I'm sure my colleagues, I'm sure we are, but I'm sure my colleagues will tell you why, if I could pass over.
So I think really good question in terms of the alliance approach. My starting point would say it was an awful lot of work developing the alliance. I think it's fair to say probably 3, 4, 5 years worth of work in terms of bringing that together. But we shouldn't be discouraged from lots of work in terms of doing the right thing. So in terms of the alliance contract, as Councillor Mahoney said, so 3.6 million. We're seeing an awful lot of demand in that area, and I think tomorrow's session, where you have a session around homelessness, then you'll start to pick up some of the challenges around homelessness presentation, temporary accommodation. So I will leave. I'll be here tomorrow, and I'll pick that up with Matt Garrett when he joins. In terms of the alliance contract, though, absolutely around the notion of how partner agencies work together has to be held up as good practice, and in fact it is. So it is nationally recognised. It's one of the things that we're really proud of, because there is of course a risk, isn't there, when we're setting budgets, that actually by looking at organisations in isolation, you can move to a place of salami slicing through contract savings. And the whole purpose of bringing the alliance together was, how do you ensure that you bring partners together to work differently, to remove duplication, to stabilise a workforce, and also to deliver a single service offer, albeit delivered by a range of agencies. So there's definitely something in that model for that cohort of people. I think, as we move forward through the fair cost of care work, there are opportunities to look at things like the home care market and the supported living market, in terms of how we may be able to move to geographical locations and approaches through some of the work that we're doing. So I think we're always looking at those alliance principles and thinking where it makes sense with NHS colleagues to join up services and where the opportunities are.
So supplemental is that's been a good model, and I suppose when you're under pressure, you don't really want to enter into another 5-year programme of a lot of intense work. But in terms of David and us as a budget setting scrutiny panel, it's to try to make the right decisions now for a longer term outcome, that we don't keep coming back repeating. Would there be mileage from your point of view in resources being set to look at a similar type alliance but in other areas that won't immediately give the result, but with work could be the pathway to more sustainable, I suppose, collaborative working, but ultimately better outcomes at a lower cost to the Plymouth taxpayers, and enhance our reputation in this particular area?
So I'm not saying no. So I think there's something around a recommendation of looking at the alliance principles and ensuring that they are considered with our commissioning intentions across adult social care and the NHS moving forward. There's probably something in that space that I'm sure would be helpful as a recommendation. So as integrated care systems develop, and very much the localism agenda, the role of the local care partnership, what could we do in Plymouth as a city around some of those, embedding some of those alliance principles through some of our other commissioning activity?
Members, just to make you aware, we are down to the last sort of 8 minutes, and we've got Councillor Lang, Aspinall and Poyser. It'll be the last three, so we can make your questions. We'll start with Councillor Lang. We can have a quick fire session, please.
Thank you. I think I probably ought to declare an interest, seeing as we're talking about the Alliance, because I'm a trustee of Path, which is a member of the Alliance. My questions are just about the capital programme. Page 4, we've got, given that we know that the health hub is not proceeding as we would wish at the moment, there's 1.458300 in the budget this year for it. So I just wondered if you could explain why that is. And we've got nearly 6.5 million for the reprovision of Vines and Colwell Lodge. And I just wondered if you could tell us where we were with that project. Thank you.
Just through you, Chair, very quickly, in terms of how quickly the finance team can react to an announcement about funding and the publication of the programme. So this listing is at the end of December, and to get that in. But having said that, that I think we heard this morning, didn't we, that there is still ambition from the leader, from the chief executive, to pursue that particular project in some form. I think it'd be rather hasty just to take the money straight out at the moment and say it's not there. I would rather have it sat there ready and we're prepared as and when we get some green light, whether it is that particular item or some alternative. But I'm quite happy to let others come in.
And as for the reposition of the Vines and Colwell Lodge, I mean, that's hopefully full steam ahead on the Outland Road site. Plans are being developed at the moment. Gary would like to say something like this.
Hi, Councillor Lang. Well, actually, there's some demolition due to start on that site in the next few months, and actually where we are in that programme is at what we call the stage 3 detailed design, and we're just preparing ourselves for some public engagement around the fact of bringing that to the city for planning applications. So it's moving forward. Those first stages are always slightly frustrating for us because you want to get and build something, but you've got to make sure you plan it right and engage with everybody appropriately. So we're at the very detailed design stage now, and we'll be bringing further updates for people.
Supplementary.
Yeah. So are we going to spend 6.491936 on Colwell in the Vines this year, as it is in the budget?
So again, we've just gone through a longer phase of going through some detailed designing because of the impacts of prices of materials, availability of materials. So that's taken a bit longer. And I think, like David's just said with the other one, we'll have to work through the profiling now. Now we've got through that phase of the capital programme profiling. So that's what we'll now be doing. It's unlikely we'll get to that spend, just to answer that very specifically, sorry. Yeah.
I'd like to add, I think it's an ideal place with the park next door. That ticks all the boxes for people having be able to get out into the green space, and I'm very pleased that it's in my ward, and I hope that I'm sure there will be no significant opposition to it.
Right. Councillor Poyser, please.
Thank you, Chair. Just coming back to Councillor Quay's question about the Alliance, which I'm really grateful for your raising, actually. It's a fabulous example of organisations working together, working collaboratively, improving the quality of the services that we deliver here as well, attracting investment and funding in. I just wanted to make sure that the funding provision that has been provided for the Alliance is in line with inflation and there's no additional budgetary pressures placed upon that group, and whether there's opportunities for other organisations to join that Alliance at a later date within, which won't have any budget pressures but will effectively enhance the services as well.
There's extra money going into drug services. Maybe Ruth might like to elaborate upon this. That's been mentioned already.
Yes, so we have additional funding for a particular area of work, which is around drug treatment services. So there's more money going into the system. In terms of the Alliance contract itself, then there are some savings built into that, which mean that they won't be, certainly from my area, it won't be an increase in line with inflation. Particularly with inflation being so large, I'm sure you'd appreciate that the public health grant has not increased by that amount, so we can't give all our contracts an inflationary increase. But we are, of course, working with the Alliance to make sure that the money that they have, the funding that they have, is used in the right way. It is obviously a difficult situation when the budgets are tight and inflation is so high, but I can assure you that we're working very closely with them. And as I say, this is additional funding going into the system. In terms of whether new partners may join the Alliance, my understanding at the moment is that wouldn't be impossible, but that the partners that are already working together are those people who are working with that very complex cohort of people who need that particular types of support. So I believe that we've already built in the partners that are needed to support that particular group of staff. But I'm sure it's one of those situations where we would never say never.
Councillor Aspinall, please.
I appreciate that every year we look at packages for of social care, Councillor Mahoney, and obviously we look to see whether we can fine tune them. But the budget is allowing for a certain amount of money. Equally, between looking to fine tune things, you can also find things become more expensive. So what is the flexibility in your budget, or the budget that you're proposing, for both a rise if needs be, even though you try to keep to that budget you set?
You say, Councillor Aspinall, things can go up and down and people's demands and requirements can go up and down, and this is where you need to actually review and reassess, because otherwise you end up with inappropriate lack of services to certain people and perhaps an over provision for others. So I'll pass you over to Gary, because I know a lot of work's been done on this, and I think a lot of work's being done in the 18 to 64 age group particularly. It's not just a question of, you know, older people.
Thanks, Councillor Aspinall. I think to try and answer your question as straightforward as I can, it's really important. We've built our budget on a plan of events that we're going to work through for next year, but we recognise there are lots of different areas of pressure for this year, and I think for us it's always then about the monitoring and oversight, so we can adapt and change our plan based on, one, what we see working, or two, if we see some of those pressures change. And probably I say a nice example, but an example of that was some of the work we did around fuel costs in terms of what was happening for domiciliary care staff. Well, actually now that profile has changed, hasn't it? So we need to make sure we adapt and make sure the way we support the market does it the same way. And we will run a number of programs through this year based on the assumptions, our planning assumptions of what we think will happen, and then our monitoring, which actually will be probably every 2 weeks. We look at how those things are going and we'll adapt. So some projects sometimes work better than others, and we'll look at that and see if our review program in 1864 starts to stall, but one of our other programs is working better. We move resources around to make sure that we can keep things going as best we can and raise the awareness of an issue as early as we can so we can react. And I think that's probably been one of our tried and tested methods of approach through all of the year, recognising there's probably a bit more to monitor this year in terms of some of the things that can happen to our budget. So I don't know, I'm hoping that kind of helps you understand the oversight that we'll take.
All right, it's 15:45 hours, bringing this section 4 to a close. We'd just like to thank David, Anna, Dr. John Mahoney and Gary for your time this afternoon and your contribution to the budget debate. So you're more than welcome to leave as and when. What we're going to do now is just enter a period of reflection. Doesn't sound good, does it? Anna. Oh, no, switch this off.